Good morning. It is my great pleasure to welcome Mike Morrissey, who is Chief Executive of European Cancer Organization, most probably the most important organization in Europe concerning cancer, which is a federation, I understand, of patient organization, healthcare specialists. But maybe you shortly introduce, the organization before we go into the question.
Well, thanks for the invitation. Good to be here. Yeah, the European Cancer Organization is a bit unique in that it's a federation of 42 European oncology professional organizations, oncologists, nurses, pharmacists of all different disciplines and professions, but together with 21 European patient organizations. And the combination of oncologists, nurses, pharmacists, and patients talking together and building consensus is super important.
It's absolutely fantastic, amazing. Cancer is still the second most common cause of death in Europe. And from your perspective as a chief executive of this organization, what are the most important priorities in fight against cancer in EU member states?
Well, I think that the first thing to say is we all know that cancer is a complex disease. It can happen in different parts of the body, it's treated in different ways, it's complex. And because of that, and because it touches so many people's lives, for a long time the European Union didn't get involved. They kind of said that's something for national governments, that's not something for the European Union. Well, that's changed recently. In this parliament, under the leadership of Ursula von der Leyen, whose sister died of cancer as a child, you've seen a different approach. Europe's Beating Cancer Plan is a once-in-a-lifetime opportunity for everybody working in cancer, everybody affected by cancer, to say it doesn't need to be like this. We can stop cancer from happening in many cases in the first place. We can prevent it. We should treat it in a much higher quality way, and we should treat survivors and cancer patients with respect. We should find them the best quality of life for as much life as they have while they've got cancer and when their cancer is cured.
So we are talking about the plan. What actions the EU is currently implementing to reduce the incidence? You talked about prevention in Europe, and to ensure effective treatment?
Well, in prevention, probably one of the biggest things that the European Union is doing is setting this target on HPV vaccination. 90% of girls and as many boys as possible should be vaccinated by 2030. Now, HPV vaccination is a no-brainer policy, a cancer that can be, or cancers that can be prevented by a vaccine. It's a no-brainer. But for some reasons, different reasons in different countries, it hasn't been happening. So HPV is a big ticket issue. It's a flagship policy under the Europe's Beating Cancer Plan. But there's other things that the European Union is doing too. For example, we are working with them and many other organizations on having better training for cancer professionals. We know that there aren't enough cancer professionals. We know that they don't know enough necessarily about what their colleagues are doing. So we've got a special training program. I was in Lisbon last week doing that training program, pilot program. It's going really well. So that better training for professionals. Another project we're working on is an app for cancer patients all across Europe that gives them access to their medical records and helps them understand the best way to survive their cancer. So they're just examples of many projects, 40-odd projects that are going on right now to try and reduce the inequality of cancer prevention and care. It's not right that a citizen of the European Union in Romania doesn't get the same access to the same quality of prevention and care opportunities as somebody in Germany or France.
I think you already answered this, but it was extremely interesting what you were talking about, like this app. Is it or will it be available across Europe in all member states? How is it going to work? What is the...
Yeah, I mean, that's the plan. The first phase, of course, is to decide what should be in it. And who should decide what's in this app? Cancer patients. So we've been talking to cancer patients and survivors, people that found out they had cancer as a kid, people who found out they had cancer as an adolescent, people who got cancer later in life, to say, what would be in an app that would really help you? So that first phase is what we've been doing at the moment. But the goal is, yes, that everybody in Europe would have access to that app and access to different services, different information about their own condition. If you travel from Poland to Belgium, for example, where I work, and something happens to you and you need to see a doctor, it's not so easy for that doctor to know what to do, because he doesn't necessarily, or she doesn't necessarily have access to information about you. So having access to medical records and being able to help a doctor not work with a blank piece of paper could be very helpful.
I would like to go back because you mentioned HPV, and September has been established as Gynecological Cancer Awareness Month. What are your reflections on that? HPV seems to be really preventable. Huh?
Yeah.
So can you talk from a European perspective about this?
Sure, there are cancers that once you've got them, once you've found out you've got them, it's almost too late. There are cancers where there's very little that you can do. Pancreatic cancer is an example. There are other cancers that you can prevent, or you can help prevent. And that's why cervical cancer is so important, because a lot of women die of cervical cancer every year and it's not needed. It's preventable through having the HPV vaccine. But for different cultural reasons, attitudes to religion, to sex, to vaccination, people have had over the years different reasons not to have vaccinations, and governments haven't always provided them free of charge. So we're very happy about the spotlight on cervical cancer, because it is one of the few cancers that can be prevented, and it's a question of education, awareness, culture, access, rather than science. In the case of many cancers, it's a question of science. This isn't a question of science, this is a question of making it happen.
If I am not mistaken, Australia is a great example of, I don't know, maybe even eradicating, the cervical cancer. Do you look at their plans? Do you look what happened there? And
yeah, but I think that the lesson is, Australia is a good example, but the lesson from HPV, I think, and vaccination programs in particular, is that each country can learn from each other. Do you remember during COVID there was a lot of that?
Exactly.
Countries learning from each other. It should be one of the benefits of the European Union. I was in Bulgaria last week talking about HPV vaccination. They're nowhere near as advanced as Poland is. There are lessons they can learn from Poland. So it's not like when we go to a country and we share an exchange, it's not like we're lecturing, that we're saying there's only one way of doing it. Actually, countries have lots of information to share with each other, and the experience in Poland would benefit other countries in Europe.
And what is the ambition when you talk about cervical cancer? What is the vision of where we want to be in 10 years, 5 years?
Well, we want to eliminate it. The ambition is to eliminate it. Now, the vaccination, the target in Europe's Beating Cancer Plan is 90% of girls and as many boys as possible. We think it should be 90% of boys as well. But the ambition is to eliminate it, and I think it is one of those targets that is doable if everybody gets behind it, and that means not just governments paying for it. It means parents supporting it. It means having awareness campaigns that support it. It means doctors and nurses and pharmacists supporting it as well. So there's a lot of people who can make it happen. It's just a question of getting all of that activity together.
Let me now focus on Poland. And since June this year, a free HPV vaccination program has been implemented here in the country for 12 and 13 years old. To date, only 12% of eligible children have been vaccinated. In your experience, what solutions, what shall be done to dramatically increase this number from low 12% to most probably 50 and above?
Sure. Well, I think the first thing to recognise is it's a good step forward. The announcement about the 1st of June introduction for boys and girls takes Poland into a much higher league within Europe of policies that will help with HPV vaccination. But policies aren't enough. The devil is in the implementation. Because if you have a great policy, then nobody goes and gets the vaccine, what's the point of that? So it means that the systems have to be geared well enough to be able to make sure that people don't just have the right to a free vaccine, but go and get their free vaccine. And to be able to measure that, you need good data. So what we are calling for is as much transparent data as can be found, to have a registry on HPV vaccination, and for that to be open for the whole public, like it was during COVID, for people to know how many people have been vaccinated for COVID. Have the same thing for HPV, because if you've got the data, you can see where things are going well, which towns, which cities, which regions are doing well, which are not doing well, and then you can start to delve into why. Is it because the vaccinations are hard to access? Is it because in one area or country the vaccines are available in school programs? You know, the devil's in the implementation, and the data helps you learn the lessons.
My question is, why boys vaccination is so important for the success of the entire program?
Well, I hate to break this to you, but since the days of Adam and Eve, it's been true that we say in English it takes two to tango, right? It's no good. Of course, there is some benefit in vaccinating girls only, but if you don't vaccinate boys, that's not going to eliminate HPV. And of course, it's not just cervical cancer that is caused by HPV. There are many awful cancers that are caused by HPV. So, and it's also about, it's not just an equality issue. It's not just a healthcare issue. It's not just an equality issue. It's about young people's attitudes to their personal lives and their own social responsibility. If you say, girls, this is for you, and boys, no entry, it encourages boys not to have a responsible attitude to this area of their lives. So we think it's really important from science point of view, from an equality point of view, but also from a responsibility point of view.
We have initial difficulties in implementation of the program here. Is there an ideal program which you can, copy paste, implement in Poland, and then, accelerate the adoption of the vaccination? What are your thoughts on that?
I think there are elements that can be shared, as I indicated, across borders, that can work across borders. But there are so many elements to attitudes to HPV vaccination. You've got the anti-vax movement generally. You've got people who have different attitudes to HPV vaccination because of their religion or because of their attitude towards sex or whatever. I tell you a story, right? There's this amazing woman, Bernie Brennan her name is. She's an Irish woman whose daughter died of cervical cancer because she said she wasn't allowed to have a vaccination because she was too young to be having sex. And her daughter died of cervical cancer. Now she's a campaigner to stop people, other mothers and fathers, from making the same mistake. It's a tragic story, but that's the reality of this. It's a sensitive subject, of course, and it needs everybody to be transparent and open about it. But that's the harsh reality of not doing something about it. It's that your son or daughter you may lose them for something that's easily preventable.
You mentioned anti-vax movements, and I mean, it's difficult to say whether COVID strengthened them or weakened, but at least it had impact. I mean, the COVID pandemic, it had impact on the movements. How to promote this vaccination and find disinformation, because we see in social media a lot of bad information, false information, right? And vaccine hesitancy in general.
Yeah, and it's a good question about whether the COVID experience has helped or hindered in that. I think it, on one hand, I think a very positive thing to come out of the COVID experience was that the European Union took a common approach to the rollout of vaccines across European Union countries. So it wasn't that everybody in Germany was vaccinated before anyone in Bulgaria. It was done on a risk basis across Europe. So the concept of a cross-border healthcare initiative in Europe was strengthened, I think. But there are people who chose to see it as after COVID was past its peak, to see it slightly as an imposition and a loss of freedom. And what we say in question of HPV is, it's true, it's a question that you have the personal freedom, but why wouldn't you do it? Why wouldn't you, if somebody told you there was a vaccine that would cure you from any possibility of all cancers, people would be lining up in the streets for it. Here are 5% of cancers or something that are preventable. Why wouldn't you do it? It's your choice, of course, but why wouldn't you do it?
Yeah. Okay, and let me finish with last question. And again, go back here to Poland, and with your experience, your breadth of knowledge, what would be your call to action recommendation for the country in terms of HPV elimination?
I would recognise the big step that's been taken for the 1st of June policy. I think that's a good step forward, but we need to make sure that people get the vaccine. That means we need to make sure it's implemented properly, and to do that we need the data. Let's have a transparent registry of data of people receiving HPV vaccines that everybody can see, everybody's aware of, and everybody can learn from where is it working, where is it not, and why.
So, Mike, thanks a lot for your time. Thanks for
Pleasure.
Coming over and for your valuable insights. Thank you very much.
Thanks to you.